All right, quick question, milady. Have you ever heard of a Spartan race?
I have. It's
Yes.
very hard.
It's very hard. It's a race filled with obstacles held here in the United States and throughout the world. And the woman you're about to meet was smack dab in the middle of one of these races when she took a fall and broke her wrist. She turned to Advanced Orthopedics New England and couldn't be happier with her decision. I'd like you to meet Liza Nolan. She's quite the athlete. On August 12th of this year, she was competing in what's called a Spartan race.
I was doing a Spartan race in Charlton, Mass.
And what is a Spartan race?
It's an obstacle course running race. This was a mid-distance one, which is about 8+ miles with obstacles in between that break things up.
And something bad happened that day.
Correct. So it was a brand new obstacle, something called beater, which is a series of monkey bars that you need to traverse. And I jumped up to get the first monkey bar, slipped, fell, put the wrist out, and it broke.
It broke?
Yes.
And you knew it broke?
I knew it, yeah, right then and there.
So what'd you do?
I had some friends around me. They called a medic, so the course has medics available, and took an ambulance ride to UMass. And immediately they told me, this is something you're probably going to need surgery for. So they thought I might need surgery that night. Turns out I didn't. They casted it. Okay. So Monday morning I started calling around to some orthopedists, and no one could take me for more than a week.
At that point, Liza called her primary care doctor and was informed about an orthopedic urgent care center in Bloomfield, Advanced Orthopedics New England.
So we went there first thing on Monday, walked in, and I was seen by Dr. Berkowitz's office.
The staff made sure to treat her broken wrist and her pain, but it turns out she would need surgery. Dr. Alan Berkowitz at the Enfield office of Advanced Orthopedics New England would be the one to do it.
He saw me in person and scheduled surgery, and it went from there. So it was quick, efficient. I got some pain relief, and the ball started rolling from there.
Dr. Berkowitz is an orthopedic surgeon specializing in surgery of the hand.
I take care of everything from the elbow down to the fingertips, so more of an upper extremity surgeon. So for Eliza, she had a displaced fracture of the wrist. We did surgery on her and fixed it with a plate and a screw system that's very strong and very stable. So she never has to be casted after the surgery. She's in a splint. Stitches come out at 10 days. She can start washing and showering the incision at that point, and slowly just starts moving it and regaining her strength and her function back. And she's progressing very nicely.
The facility that I'm in right now in Enfield is by appointment only, but that's all about to change. This is going to become an urgent care facility where you can walk in and get treated immediately.
The nice thing about the urgent care is we have specialists in every field of orthopedics. So I'm a specialist in the hand, elbow, upper extremity. We have specialists in spine. We have specialists in sports, shoulder and knee injuries. We have a specialist in foot and ankle. So we have all the areas of orthopedics with specialty training available on a walk-in basis.
Would you recommend an urgent care for other patients?
Absolutely. You know, waiting a week after suffering, you know, a fall like that, that was a lot. I don't think I could have done that. So going into the walk-in orthopedist was just an immediate solution to the problem. And, you know, I felt like they were quick, efficient, and able to hear what I had to say about the injury, get me some pain relief, and get me towards a plan of recovery.
And she plans on doing more Spartan races.
Oh my goodness,
She's gonna
good
get back
for
out
her.
there. All right, you can learn more at ctortho.com.
Good, they can fix her up so she can do more of those.
Exactly, right?
And we're just getting